Welcome back to the Deep Dive. Today we're diving into something super important for future nurses, and that's anger and aggression management. Think about it, you'll be working with patients from all walks of life, and we all know hospitals can be pretty high-stress places. So figuring out how to handle those really intense emotions, both in your patients and yourselves, is going to be key for giving the best care possible.
You're absolutely right. It really is. It's not always given enough attention in nursing school, but it's something you'll use your entire career, that's for sure.
No doubt about it. So to get us started, let's define what we're even talking about here. Anger, aggression, those words, they kind of get tossed around, but there's a difference, right? A subtle but important one.
Absolutely. Think of it like this. Anger is the actual emotion. It's that feeling of frustration or being irritated or even just plain rage. It's a totally normal human thing to feel. Aggression, on the other hand, that's how that anger comes out. It's the attempt to hurt someone or control them, and that can be with words or actions.
So it's not always a direct link. Just because someone's angry doesn't mean they're going to, explode.
You got it. There's a bunch of factors that come into play, and honestly, that's what makes this whole topic so interesting. Part of it, believe it or not, is actually built into us, our biology. Our brains are amazing, don't get me wrong, but sometimes things can go wrong. Abnormalities, like if someone has a tumor or had a stroke, that can actually mess with their ability to control themselves.
Whoa, really? So something physically happening in the brain can make someone more aggressive.
Exactly. And then there are these things called neurotransmitters. They're like chemical messengers in our brains, and they control our moods, behavior, tons of stuff. And when they're out of balance, like with serotonin, dopamine, norepinephrine, even testosterone, that's been linked to aggression too.
It's wild, like a balancing act happening up there. Can you tell me more about how those neurotransmitters actually make someone aggressive? Like, what's the process?
Well, think about dopamine, for instance. If someone has high levels of dopamine, they might be more impulsive, take more risks, which can obviously lead to more aggressive outbursts. On the flip side, low serotonin, that's been linked to not having good impulse control and, yeah, more aggression too.
That makes sense, like a little tug of war going on with these chemicals.
Hmm.
But it's got to be more than just biology, right? Our childhoods, what we go through, that must play a huge role in how we handle anger.
You're spot on. The environment we grew up in, the people around us, those things totally shape how we understand and show anger. Think about kids, they're like sponges, absorbing everything. If all they see is people getting aggressive when they're mad or frustrated, well, they're probably going to do the same thing.
It's like monkey see, monkey do, but with something way more complicated.
Right, and it's not just about seeing it. Sometimes aggression actually gets rewarded, even by accident. Picture a kid throwing a tantrum, and they get what they want because the parents give in. That's operant conditioning, plain and simple. The behavior works, so they do it more.
Ah, so it's a vicious cycle. They get what they want by being aggressive, so they'll do it again. Fascinating. Can you explain that operant conditioning thing a bit more? I bet some folks listening aren't familiar with that term.
Totally. It's basically how we learn. Our behaviors get stronger or weaker depending on what happens afterward. So with aggression, if being aggressive gets you attention or power or whatever you want, then you're likely to do it again.
That makes it crystal clear. So we've got biology, we've got learned behavior, but there's another layer, right? It's got to be how we see things too. If someone thinks everyone's out to get them, that's going to cause problems.
You hit the nail on the head. How we think, how we see things, how we make sense of social cues, those cognitive processes, they're huge in determining if we react with anger or aggression. Someone who's always misinterpreting things, seeing threats everywhere, they're primed for conflict, even if it's all in their head.
Totally get it. It's like nature and nurture all mixed together. But here's where things get really interesting, especially for you future nurses. It's not just what's going on inside us. Our environment, social stuff, that plays a big role too, doesn't it?
Absolutely. Things like poverty, inequality, exposure to violence, that can create a breeding ground for anger and aggression. Think about living in a community with no resources, no opportunities, constant danger. That takes a toll, and people are much more likely to lash out.
It's like all these factors just colliding. Biology, how we were raised in a stressful environment, and then toss in things like substance abuse.
Oh yeah, substance abuse is huge. It often makes things way worse. Alcohol, stimulants, hallucinogens, they all mess with your brain, lower inhibitions, make you impulsive. It's like pouring gasoline on a fire that's already burning.
Wow, that's a powerful image. So with all this knowledge, how do we as future nurses actually use this? Say we're on a busy hospital floor and we see a patient getting agitated, maybe showing signs of anger. What should we watch out for? What can we do to calm things down before it gets out of control?
That's where understanding what we call the anger aggression cycle is so helpful. It's like a roadmap for these tough situations.
Okay, I'm all ears. Tell me about this anger aggression cycle. How does it work?
Well, it's a model that helps us understand the different phases of anger and aggression, starting with something that triggers it and potentially ending in a crisis. There are 5 main phases to remember.
Let's break them down. What's the first phase?
The first one is the triggering phase. This is where something happens inside the person or around them that sets off those first feelings of anger. It could be a fight with someone they care about, or something frustrating at work, or even just being stuck in traffic.
It's like something flips a switch and all of a sudden those anger circuits are activated.
Precisely. And it's important to remember triggers are personal. What makes one person angry might not bother someone else at all. It depends on the person and their experiences.
That makes sense. So once that trigger is pulled, what happens next? How does anger escalate?
That leads us to the second phase, escalation. Those initial feelings of anger get stronger. Physically, you might see their heart rate go up, breathing gets faster, muscles tense up, maybe sweating, and their behavior changes too. They might get argumentative, their voice gets louder, they start pacing.
So their body and mind are both preparing for a possible confrontation.
Exactly. And this is the time to do something, because if we can see these early warning signs and intervene the right way, we can often stop things from getting worse.
I see. It's like stopping a snowball before it turns into an avalanche. What happens if those early interventions don't work? What does the next stage look like?
Well, if the anger keeps building, it can reach a crisis point. That's the third phase. This is where it can get dangerous. The person might completely lose control and lash out verbally or physically, yelling, screaming, throwing things, even becoming violent towards themselves or others.
That's a scary thought. And I imagine as nursing students, we're not trained to deal with that on our own, right?
You're absolutely right. This is where you need to call for backup. Follow the protocols your hospital or clinical setting has and make sure everyone's safe. Sometimes medication is needed to calm the person down. For example, there are medications like lorazepam or haloperidol that can help reduce agitation and aggression in these situations.
I'm guessing those are what we call PRN medications, meaning they're given only when needed under the supervision of a healthcare professional.
That's right. And then there's also the possibility of using restraints or seclusion, but those are absolutely last resorts, and they come with a lot of ethical considerations.
Yeah, I can imagine. Restraints and seclusion should only be used when there's a real and immediate danger, right?
Exactly. The goal is always to de-escalate using the least restrictive methods possible. But even when the crisis is over, we're not done. We enter the recovery phase, where the patient starts to calm down and the aggression fades. You might see regret or even exhaustion.
So the storm has passed, but there's still work to do.
Right. And it's a good time for reflection, for learning. It's a chance to help the patient figure out what happened, what their triggers are, and how to cope better next time.
So we're not just putting out fires, we're teaching patients about their anger and how to handle it. I love that. What's the last phase of this cycle?
The final phase is the post-crisis phase. This
Yeah.
is when the patient has calmed down and can actually think about what happened. It's time to process the event, deal with any guilt or shame, and make a plan to avoid similar situations in the future. Basically, turning a bad experience into a chance to grow.
This is all so fascinating. I'm really starting to see how complex anger and aggression are. And I bet our listeners are eager to hear more about what nurses can actually do, the tools and techniques we can use. But first, I want to bring in a special guest who can give us even more insight into the biology of anger and aggression.
I think that's a great idea. Hearing from a neuroscience expert would be super helpful for everyone. So, to really dig deeper into the science of anger and aggression, we have Dr. Smith with us today. Dr. Smith is a leading researcher in this field. Welcome to the deep dive, Dr. Smith.
So glad to have you here. I'm especially interested in hearing more about those neurotransmitters we talked about before, like serotonin, dopamine, norepinephrine. How do they actually affect aggression?
Well, it's pretty complicated and we're still figuring out all the details, but basically these neurochemicals are like messengers in your brain. They send signals between neurons, and they're super important in regulating emotions, behaviors, even how we think.
Makes sense. So if they're out of whack, that can really mess things up.
Exactly. Like studies have shown that low serotonin is connected to being impulsive, aggressive, even violent behavior. Serotonin, people call it the feel-good neurotransmitter. It helps with mood, sleep, appetite. When it's low, people can't control their impulses as well and might react aggressively if they feel threatened.
Interesting. So it's like serotonin keeps us from just acting impulsively.
That's a good way to put it. Then there's dopamine, usually linked to pleasure and rewards. But dopamine's also involved in motivation and drive. And when it's high, it can actually increase impulsivity and risk-taking, which, like we talked about before, can lead to aggression.
So it's not just about how much of each neurotransmitter we have, but how they all work together.
You got it. It's a balancing act, and even small changes can have a big effect on how we behave.
This is all so helpful, Dr. Smith. Thank you for sharing your expertise with us.
Yes, thank you so much, Dr. Smith. It's always so interesting to hear about the biology behind how we act. But now let's switch gears a bit and talk about what this means for nurses in their everyday work.
Okay, time to put on our nursing hats. What are some key things we should remember when we're working with patients who might be struggling with anger or aggression?
Well, like we've been talking about, it's important to remember anger is a normal human emotion. It's often a reaction to pain, fear, or frustration. So the first step is to approach the situation with empathy and understanding.
That makes sense. We need to see the person, not just the anger they're showing.
Exactly. And remember, as nurses, you're working with people who are often going through incredibly tough times. They might be in pain, feeling vulnerable, dealing with a serious illness. It's understandable their emotions are going to be heightened.
So patience and compassion are super important. But what about those situations where a patient's getting angrier and angrier and we need to calm things down fast? What are some things we can actually do in those moments?
One really effective technique is just to validate their feelings. Let them know you hear them, you get why they're upset, and you're there to help.
So don't tell them to calm down, but let them know it's okay to feel what they're feeling.
Exactly. You could say something like, I see you're really frustrated right now, and I want to understand what's going on. Sometimes just feeling heard and understood can make a huge difference.
That's such a simple but powerful thing to do. What else can we do to help a patient de-escalate?
It's also important to pay attention to what you're doing, your body language. Stay calm and relaxed, make eye contact, and use a soothing tone of voice. Don't cross your arms or stand too close. Those things can make you seem threatening.
It's about making them feel safe and like they can trust you.
You got it. And sometimes it helps to distract them. You could ask them about something completely different or suggest something calming, like listening to music or taking a walk.
These are all great tips.
Mm.
I can see how they could really help de-escalate things. But what about those times when just talking isn't enough? When a patient is getting dangerous to themselves or others?
Well, like we talked about earlier, that's when you might need to get help from other healthcare professionals, follow your hospital's rules, and maybe think about using medication, or in extreme cases, restraints or seclusion.
Right. And I know those decisions are never made lightly. It's always about keeping the patient safe. But let's talk more about those special approaches to managing anger. You mentioned CBT before. Can you tell us more about that?
Of course. Cognitive behavioral therapy, or CBT, it's all about helping people recognize and change their negative thoughts and actions. It's really effective for a lot of mental health stuff, including anger management.
So how does CBT actually work for anger management?
Well, one of the main ideas in CBT is that how we think, feel, and act are all connected. So if we can change our thoughts about something, we can change how we feel and react to it.
So it's like challenging those negative thoughts that automatically pop up and make us angry.
Exactly. Like, let's say a patient always jumps to conclusions or thinks the worst will happen. A CBT therapist would help them see those thought patterns and replace them with more balanced and realistic ones.
That makes sense. And I imagine CBT also teaches people practical ways to deal with anger when they're feeling it.
Absolutely. CBT therapists teach techniques like deep breathing, relaxation, and how to communicate assertively so people can manage their anger in healthy ways.
Those are great tools to have. So CBT sounds like a really helpful option for people who have trouble managing anger.
It definitely is. And it's often used along with other therapies like anger management groups. Those groups can be a safe space for people to talk about what they're going through and learn from each other.
It helps to know you're not alone, right?
Absolutely. And sometimes medication can help too, especially if the anger is coming from another mental health issue like depression or anxiety.
That makes sense. So it's about finding the right mix of therapies and treatments for each person.
Exactly. There's no one-size-fits-all solution for anger management.
This has been so informative. I feel much more prepared to understand and handle anger and aggression when I'm working with patients.
I'm happy to hear that. But before we move on, I want to touch on something we mentioned before, taking care of yourselves as nurses.
Oh, yeah, that's important. We talked a lot about managing other people's anger, but what about our own?
You got it. Being a nurse is stressful physically and emotionally. You're dealing with difficult patients, long hours, and high-pressure situations. You're going to feel angry or frustrated sometimes. It's normal.
That's for sure. So, what can we do to stay calm under pressure?
Well, the most important thing is to know your own triggers, what sets you off. Feeling overwhelmed, difficult personalities. Once you know what your triggers are, you can come up with ways to deal with them.
So it's that classic advice, know thyself. Figure out what pushes your buttons and have a plan.
Exactly. And don't be afraid to ask for help. Talk to your coworkers, your boss, a therapist. It's okay to need support. Remember, taking care of yourself is just as important as taking care of your patients.
It's like the oxygen mask on a plane. You have to put yours on first before you can help anyone else.
Exactly. And don't underestimate how important self-care is. Make time for things you enjoy, things that help you relax and recharge. Whether it's exercise, meditation, being with people you love, or just reading a good book, those little things can make a big difference.
Those are great reminders. It's so easy to get caught up in work and forget about ourselves.
It happens to all of us. But we need to be careful. Burnout and compassion fatigue are real problems for nurses.
This whole deep dive has been so eye-opening. We've looked at the complicated ways biology, psychology, and our environment all play a role in anger and aggression. We learned about de-escalation techniques, therapies like CBT, and how important it is for nurses to be self-aware and take care of themselves.
And we've just scratched the surface. But hopefully this gives you a good foundation for understanding and managing anger and aggression in your future careers.
I think you're right, and I bet our listeners have a lot to think about after this episode. But before we wrap up, I have one last question.
Sure, go for it.
We've talked a lot about how to recognize anger and aggression and how to de-escalate those situations. But what happens when those de-escalation techniques just don't work and a patient becomes violent? What do we do then?
Well, like we said earlier, in those really extreme cases, when a patient is a real danger to themselves or others, we might have to consider more restrictive interventions. Things like medication, restraints, or even seclusion. Those are always last resorts, though, and they should only be used after really careful consideration and always following strict protocols and guidelines.
I bet there's a ton of paperwork involved too, right?
Oh, absolutely. Every single time restraints or seclusion are used, it needs to be carefully documented. The reason for using it, the patient's behavior, how long it lasted, any observations, anything that happened during that time.
It sounds like a really serious process.
It is, and for good reason. These interventions can be traumatic for patients, and they come with risks. So it's so important that they're only used when absolutely necessary and with complete respect for the patient's dignity and safety.
That makes a lot of sense. I'm also curious about the role of medication in managing anger and aggression. You mentioned lorazepam and haloperidol earlier. Can you tell us a bit more about how those work?
Sure. Lorazepam is a benzodiazepine. It basically enhances the effects of a neurotransmitter in the brain called GABA. GABA calms the nervous system down, so lorazepam can help reduce anxiety, agitation, and aggression.
So it's like putting the brakes on those overactive anger circuits.
That's a great way to think about it. Haloperidol, on the other hand, is an antipsychotic medication. It works by blocking dopamine receptors in the brain. Remember how we talked about dopamine being involved in motivation and drive? Well, when there's too much, it can lead to agitation and psychosis.
Right. So haloperidol helps to get those dopamine levels back in check.
Exactly. Both lorazepam and haloperidol can be really helpful in calming down agitated patients, but they can also have side effects, so they're always prescribed and given under the supervision of a doctor or qualified healthcare professional.
Of course, that makes sense. So we've talked about a lot today, from the biology behind anger and aggression to techniques for de-escalation to medications and restraints in extreme situations. But before we wrap up, I want to go back to something you mentioned before about self-care for nurses.
Yes, absolutely. It's so important for nurses to make their own well-being a priority. This job, it's demanding, no question. We're constantly facing stress, trauma, emotional burnout. If we don't take care of ourselves, we can't take care of our patients the way they deserve.
Couldn't agree more. What are some things nurses can do to manage their own stress and avoid burnout?
It all starts with recognizing the signs of burnout. Things like feeling emotionally drained, cynical, detached from your work, trouble sleeping, physical symptoms like headaches or stomach aches, and even just feeling like you're on autopilot.
Those are all really important warning signs to watch out for.
They are, and if you're experiencing any of those things, reach out for help. Talk to your colleagues, your supervisor, a therapist, even a friend or family member you trust.
And don't forget about taking care of yourself. Making time to relax, recharge, and do things you enjoy. That's not selfish. It's essential for staying healthy, physically and emotionally.
I wholeheartedly agree. Even simple things like exercising, spending time in nature, meditating, yoga, or even taking a hot bath can make a big difference.
This deep dive has been so insightful. We've really gone deep into the world of anger and aggression, haven't we? We've explored all the different factors that contribute to these emotions, the biology, the psychology, the environment, and we've talked about strategies for recognizing, de-escalating, and managing these behaviors in our work as nurses.
And something we can't emphasize enough, we've talked about how important self-awareness and self-care are for preventing burnout and compassion fatigue, especially for nurses.
To everyone listening, remember, anger is a normal human emotion. It's how we choose to express and manage that anger that makes all the difference. By understanding that anger-aggression cycle, learning healthy coping skills, and making your well-being a priority, you can handle these challenging situations with confidence and compassion.
Thank you so much for joining us on this deep dive into anger and aggression management. We hope you found it informative and empowering. Until next time, stay curious, keep learning, and keep diving deep.